Let's listen to an expert doctor for hypertension in young population along with coronary artery disease or higher heart rate. Can be sure of happy heart?
I'm Dr. Sebastin, the Chief Operating Officer of Fatima Mother Hridayalaya. I'm currently working in Wayanad district of Kerala.
How do we define hypertension? And when should we conclude that the person has hypertension?
Actually, hypertension is defined as systolic BP of any patient above the age of 18 with a systolic blood pressure more than 140 millimeters or diastolic blood pressure of more than 90 millimeters of mercury. So what happens is at least 3 readings in different setting of this BP should be recorded before we naming the patient as a hypertensive. So if you see a patient with a BP of systolic BP of 150 or 160 on one occasion, and all other occasions if the patient is having a systolic BP of less than 130, usually you don't name this patient as hypertensive. So what is actually required is you should measure the BP of the patient on 3 different occasions so that all the readings should be above 140/90. Only then you can define the patient as hypertensive.
Can high blood pressure be completely cured?
High blood pressure cannot be cured because once the patient becomes hypertensive, that's due to many reasons, many underlying causes, maybe due to the permanent changes in the blood vessels or due to other factors in the body. So once the patient becomes hypertensive, some patients can be cured. For example, some diseases like pheochromocytoma where the BP increases due to some external factors or some other diseases. Once you treat the disease, the patient will become normotensive. The patient will be normotensive. But if the patient is having primary hypertension, then definitely the BP cannot be cured completely. The patient should be on lifelong medications, but only thing is you can by lifestyle modification, exercise and all other modalities, you can actually reduce the BP along with the medications, but the medications cannot be completely stopped.
Has there been a recent increase in the incidence of hypertension and heart attack among young patients? If yes, what could be the underlying cause?
See, actually, as you've rightly told, there is an increase in the number of hypertensive patients and heart attacks in the recent years. It's multifactorial. Actually, there are many factors which is contributing to this one. One is the lifestyle. Then next is the diet, the sedentary lifestyle, and other comorbidities like diabetes, cholesterol, and the unhealthy diet. All this contributes to the increased incidence of hypertension and heart attacks. The only way to reduce all these incidents is the first thing is the lifestyle modification. That means adequate exercise, a controlled and balanced diet, reduce the stress, and reduce other comorbidities or control other comorbidities like hypertension and hypercholesterol. I think by these factors are actually contributing to the increased incidence of heart attacks in patients.
Thank you, doctor, for your valuable response. Public Awareness Initiative by Glenmark Pharmaceuticals.